Hello, my name is Cynthia, and today we're going to be performing 4 skills. The 4 skills are inserting the nasogastric tube, irrigation, suctioning, and removal of the tube. We're going to begin this process by first checking the MAR, making sure that it indicates that all 4 orders were ordered by the physician. Once we verify that, we identify our patient, make sure it's the right patient, and we could assemble our equipment. And we make sure that we have tissue, tape, water, normal saline, gloves, lubrication, a syringe, your nasogastric tube, and your stethoscope, and a towel as well. We place the towel underneath the patient's chin, and we can go ahead and start by providing the privacy, performing hand hygiene, and donning our gloves. At this point, we also have to remember to keep the patient in high Fowler's position. Okay, once all that is ready, we can go ahead and grab our nasogastric tube and measure it from the tip of the nose to the ear, from the ear to the xiphoid process. At this point, we will tape off our marking like I did here already to indicate that this is how long the tube is supposed to be inserted inside our patient. We will first like to coil it around your finger to give it more curvature so it can go easily into our patient's nose. We make sure to lubricate our tube, and we can go ahead and start the insertion by first asking the patient to tilt their head back. In the moment of the insertion, you might feel some resistance. At this point, you just turn and continue pushing. At this point, the patient might start to gag, and you can provide some water. You provide water, and at every sip, you can push a little further in with each swallow. At this point, if the patient is still gagging, we can check for proper placement, making sure it's going down the right way by, with a pen light, checking down the pharynx. If it's in the proper direction still, we can continue our insertion. Once we feel it's right, we just push about 2 inches more, making sure it's in. At this point, we can check the proper placement one of 2 ways. The first way would be by removing the vial, and we do this by attaching our syringe to the white end of the tube and removing 10 cc's of vial. It may be green in color. Go ahead and recap. We put it on our pH strip, and it'll indicate that it's a level 4, and that means it's proper placement. We discard our dirty syringe and we get a clean one. At this point, we can check it the second way, which is by introducing 30 cc's of air into the clear tube while simultaneously listening to a swishing sound in the abdomen. And you place this through the blue tube. So as you're inserting the air, you do it slowly, for some patients can experience nausea. So I did in fact hear the swishing sound, and I go ahead and recap it. So once that we verify that it's proper placement, we can continue into the irrigation process. And we do this by getting our syringe and getting 30 cc's of normal saline, and we introduce this into the clear tube. Again, Again, we do this slowly to diminish the nausea feeling in our patient. And you're not supposed to drop it on the floor. You recap. And then you clear the rest of the tubing with 30 cc's of air to remove any residual stuff in there. And again, the air goes only in the blue tube. Nice and slow. Once we finished our irrigation process, we are now ready to do our suctioning process. By this, we get our tube, we connect it to the irrigation machine, we turn it on, and we have to make sure it's from 80 to 100 millimeters of mercury. We set it to intermittently or continuously. And once the irrigation process is done, we turn off our machine, remove the tube from the irrigation machine, and we're now ready for the removal part. We do this by gathering a tissue, asking the patient to take a deep breath and hold, and at this moment we're going to pull quickly and smoothly. We clean off any excess and discard any and all materials that were used. At this point, we make sure to discard all the materials that we used properly, perform proper hand hygiene, and keep our patient in a comfortable position with raising the bed rails, putting the bed in low position, and providing the call light for any further assistance. After that, we document all of our findings and all the skills that we performed today, and then that would conclude our skills for today. Thank you.